people that did not make it. I hope everybody is finding it. My name is Shay. I am a registered nurse. I've been in healthcare for over 20 years. I graduated high school when I was 16 and went straight on into college, and literally, like, I've been in healthcare my whole life. I grew up on a farm in Taylorsville, Kentucky. I have been working my entire life. Okay. My grandparents raised me. Um, I literally am not afraid of hard work. Um, I go hard. I'm 43 years old. I will be 44 next week. I can still pull, and even though my health hasn't been great lately, I'm still able to knock out 5, 6, 7, 12-hour shifts in a row. And it's not just, obviously the economy sucks, but literally the art of nursing is because you have the heart for it. Okay. You have the heart. Welcome in, Omar. You have to have a heart to be a good nurse. You have to give your entire heart. You have to, when you do it with your heart, you want to educate yourself. You want to be the best nurse you can be for that patient. Because not only are you the patient's nurse, you are also the family's nurse. Okay? Everybody looks at the Nclex like, why is it so hard? Guys, the Nclex, number one, it's not easy to pass, but it's not difficult. The Nclex is a strategic test to see how safely you can make a decision to take care of people's family members, a live person in the flesh. Okay. Welcome in, Christina. Guys, make sure you go right here and get your daily heart me. That's like an attendance. Just click in for attendance. Okay. And tap the screen, if you will. That's like in the live. Tap the screen, comment in the comment sections when I ask questions, answer. Follow Christina. We like this live, and we're interested, okay? And it deserves attention, and that way we'll get on the FYP. It's not obviously I do this because not just for I'm doing it because I want to, but this is my second source of income that I'm working on. So that's something that I need from you guys, support, just like I'm helping support you. You want to equip yourself with the best possible information. Okay. In order, and I know you guys have heard evidence based practice a million times, right? Everybody know what evidence based practice is? Put a one in the chat if you do. Um, Evidence based practice. Does anybody not know what evidence based practice is? Thank you, Brianna. Thank you, love. Listen, Brianna, everybody in here, right here. Everybody in here, right here. From your heart, you want to equip yourself. Number one, I'm just going to tell you this. When people pass away and they're in your care, if you have any kind of conscience, you're always going to question yourself. Thank you, love. Thank you, Brianna. You're always going to question yourself. Was there anything in this for the right reason? Because I'm going to just tell you right now, y'all, I love you to death, and I ain't trying to steer you in the wrong direction, but baby, the money ain't all that great. We play in people's bodily fluids and all that stuff, okay? So the Nclex is not meant to be easy because number one, once you pass your Nclex, you are a licensed professional to where you will be taking care of real live human beings. And that's serious. So the people that wrote the test, they probably don't even know all the information they put on there. It's not meant to see how much you can memorize. Okay? It's meant to see how you can prioritize different situations. If you guys look at, and mine's in black and white because I don't have any color ink today, but if you guys looked at the handout that I sent you via email, it breaks the question down. Okay. I'm going to say this. If you look at your question like you do a patient, okay? You look at, thank you for liking the live, Christina. Everybody that has done what I ask you to do, I greatly appreciate you. Thank you so much for supporting. You never got what, Christina? Did you check your spam? Because a lot of people said it went to their spam. Hang on a minute. If you didn't get it, your email and I will send it to you real quick. Let me know. Okay. Let me know when you DM me your email, just so I don't have to go look for you because I have like 150 messages. Go over and DM me right quick. Hang on a minute. I might be able to do it this way. Hang on. Hang on a minute. No, I can't do it that way. Okay. Guys, just bear with me one moment. Everybody from the FYP, welcome in. We're talking about test taking strategies to help us pass the Nclex. Y'all, I'm here. Z Morgan 5609 iCloud. Okay, hang on, baby. when I'm ever in doubt. And guys, I'm a hell of a test taker. Digital Heather, welcome in, sister. We're doing test taking uh strategy. Anyway, back to what I'm saying. Y'all, my stuff is all jacked up today. Got my little things back. Okay. So back to what I was saying. Um Lord have mercy. All kinds of technical difficulties today. If you're in doubt, if you are in doubt, go with the answer that revolves around safety. Okay? Go with that answer if you're in doubt. If you absolutely cannot figure it out, the Nclex wants to always know how you can safely take care of your patient. What is it that you need to do that's life-saving or safety, period? Okay? Put a 1 in the chat if that makes sense. Come on, y'all. Y'all gotta come on and communicate with me now. Thank you. All right. Another thing, I told you it's not a test of memorization. For everybody that goes out here and crams and crams, thank you, Brianna, and crams, why are you doing that to yourself? The night before your Nclex, you should go to bed at your normal time. You should rest, get your 6 to 8 hours of sleep. When you wake up in the morning, you should eat a well balanced breakfast. Breakfast is called breaking the fast. They call it a breaking the fast for a reason. You need to eat breakfast, drink you some water, drink you some orange juice, get your endorphins going. And another thing, too, if you work night shift, don't schedule your test for 8 a.m. Your circadian rhythm, it matters. Okay? You need to be in the, what makes you the most comfortable is the situation you need to be in. Okay? But stop cramming. Anybody and everybody. The reason that people feel like just doing questions over and over again matter is because there's only so many ways to ask a question. Okay? So I guess if I didn't pay all those monies for those big classes, and I'm gonna tell you why, because I didn't need to. I can make my own flashcards. Okay? Now, for like pharmacology stuff and things like that, I did make flashcards, but I only did drug classes. LOL is a beta blocker. Okay? I know that. My SSRIs, my calcium channel blockers, my benzos, like I know those things. So yes, I made flashcards for the drug classes and the side effects. Okay? But I can't make flashcards about every symptom of every disease. It's crazy. You just realize the time. It's okay, baby. It's okay. Come on in. I'm glad you made it. Okay. I am recording this, so I will post it for the people. Y'all, I have Discord. I got to get all this stuff together. So we're going to have a Discord and all the good stuff. Okay. Because people just can't. There'll be some people come in and try to steal my stuff. So, all right. I almost forgot where we was at. Guys, if you're just now getting here, Muhammad, welcome in. Get your daily heart me. Please do your attendance. Check in. Let TikTok know you're here. Okay? This lets TikTok know that I got something to talk about and it's important. So hit that daily heart me, tap the screen, and share out the live to the whole wide world. Okay? Now, so moving on. I don't want to go over the same thing. Okay. So as I said, you don't need to memorize. Thank you for that heart me. You do not. Our community just teared up. Woo woo. Okay. Y'all, what are we gonna call ourselves? Because once y'all pass y'all's Nclexes, you can't leave me. Okay. Are we gonna be the R influencers? I call myself the R influencer. So we're gonna be the nurses on the rise or something. Okay. I got to find something to name us on our other page. And as soon as I get my followers up, I'll be able to go live over there. Cause this is actually, it's glitching. No, Nurse Warriors. I got Nurse Warriors. Is it still glitching? Welcome in, Josh. That's a pain in the butt. All right, so we got Nurse Warriors. That's one. I got my other phone on so I can actually. You said crying RN. Liz. Liz said crying RN. I know, right? Y'all, if y'all see some of my videos, there'll be some days I come home from work and I'm literally crying like, I'm sick of this. Right? But it's a calling. And it's just how it is. All right. I know y'all didn't come here to listen to me talk about myself, but and then to no guys, if you all leave before it's over, because I want to talk with you all. I know people have got tests coming up and there's more to it than just today. I know you all got tests coming up. I want to see what a good schedule is so we can all work together. I work night shift. I want to find out what works best for everybody. Okay. I know I can't make everybody happy, but I'm going to try to do the best I can. Okay. So we are not going to memorize the entire MedSurge book. Okay. All you need is a strategy to cut out the noise. Are you guys understanding? I know we only went over one question, but are you grasping what I'm getting at? And if so, was it helpful? My light's blinding me. Was that helpful to you all? Is that something that you did not already know? It's glitching again. TikTok is like that. It's not glitching on my end. I turned off the Wi-Fi, so hopefully that helps. Guys, if this is something it is helpful, Liz, okay. Has anybody ever tried to explain it to you like this before? So I'm gonna move on. I'm glad I want it to be helpful. And like I said, if it's not, guys, you have to tell me. Okay. I can adapt. People learn differently, and I get that. So we're not memorizing the MedSurge textbook, okay? Safety. Y'all need to put safety in the chat, y'all. Safety. Tina, welcome in. Safety. Not the answer ABC. Okay, we're not going to do C for every question we don't know. You're going to look, you said, yes, it helps me slow down and read through the question. I have a bad habit of jumping to the answers. Safety. That's what I'm talking about. Safety. Thank you all for contributing. Okay. So this guide that I gave you all, guys, it's a digital product that I created. I could have sold it to you along with the rest of the information that I got. I wanted you to have this, and I'm going to put a link in my bio. It's going to be on this page though, because I can't do it on the other one yet. I have lots of things that I've created that's helped me along the way. Okay. Welcome everybody on the FYP. Come on in. We're talking about Nclex test taking tips. Okay. So we're not going to memorize. We're going to stop guessing and start dissecting the question. Do not jump around. If you're like me, you want to go look at the answers and be like, okay, let me see if I can figure out the question by looking at the answers. Don't do that. Just cover the answers up. Read the question, dissect it, find what the question is asking you, then go to your answers and look to see what is the safest answer. Okay? Just remember safety. All right. Now, they have to know the anatomy. Okay? Before you answer a question, you have to know the anatomy of the question. Welcome in, Welsh Wizard. Okay, thank you for liking the live, Christina. The item is the whole package. The scenario is the question. To come in, and I want this to sink in. This is important. Comes in with chest pain. What do you do first? The root is the golden ticket. Y'all, the root is the core of the question. If you strip away the age, the fluff, and all the distractions, okay, what are they actually asking you to do? The one correct answer. Okay? The distractors are the incorrect answers. Listen to me carefully, okay? They are called distractors for a reason. They're meant to distract you. You want to know why? Do you think you're going to have a patient in the middle of an emergency if there's a code called and there's all types of crap going on in the room? Guess what all that crap is? Distractors. Okay? This morning, I kid you not, I had my patient, okay? She literally came in, and guys, listen, I know that y'all don't want to hear my stories, but it's important, so I'm using it. My patient came into the hospital a few weeks ago and has a history of a severe GI issue, and she comes to the hospital all the time. Come in, her belly's hurting, blah blah blah. They sent her home because she's a friendly face, and then ends up that she had Crohn's. Right, she wasn't getting enough oxygen to her intestine. Welcome in, D King Lover. So if you don't get oxygen to a body part, it makes it die. Correct. Yes. Do you know what ischemic mesenteric bowel is? If you don't, look that up. So anyway, long story short, she had some outcomes from that. She did great all night long. I titrated her down on her oxygen, and she's on Optiflow, so it's pretty high. She was doing fine. Then all of a sudden this morning, the doctor comes in. They talk to her about surgery. She had her pain medicine, and she was trying to do her incentive spirometry. She got into a coughing fit that she couldn't recover from. And why? Welcome in, Muhammad. Why do you think she couldn't recover from it? Number one, because her respiratory system was already weak. Number two, she had her pain medication, right? All those things play a factor. Okay. Um, and then all of a sudden she desats down into the 50s. And I've got her maxed out on Optiflow. Well, we call her rapid. There's 15 people in the room. I'm trying to push medicine. Respiratory's trying to get ABGs and get her on BiPAP. The doctor's in there trying to figure out what's going on and the story. There's multiple nurses there. We got pharmacy there because they have to give us the meds from the crash cart. We've got lab is there in case we need stat labs. Like all of that is a distraction. Do you know what I did? My patient was anxious. She still, all that stuff made her even more anxious. So I held her hand. I looked at her about this close. I said, look at me. Stop. I need you to breathe. That's your job right now is to breathe. Block everything else out. When people are writing the Nclex questions very strategically, it is meant to distract you because they want you to answer that question like you are right there in the room with that patient. You're going to have distractors, guys. You are going to have distractors. Put a one in the chat if you understand that. And I'm going to tell y'all something you may not know about me unless you looked at my content. I actually, thank you all. Thank you, Liz. And WAP, thank you. I want you all to remember something. When I say I know what it's like to lose due to lack of assessment, I do. My first daughter was born at 24 weeks. She was a micro preemie. She lived for a month. My baby passed away from necrotizing enterocolitis. And by the time she was diagnosed, it was totalis, which means there's no fixing her belly. She'll never come home. And that was it. Okay. Had she been diagnosed sooner, they could have saved her life. Okay. So when I tell you that every day I move with pure intention and love, doing this, I call it the Lord's work. This is a calling. You have to equip yourself. There's a reason for me going here with this. If you come into work that's already stressful and you bring the crap from the outside with you, because that's also a distractor, then you have all these distractions in the hospital your entire shift. Welcome in, Coach Jen. You have all these distractions around you. You have to be able to block all that noise out and focus on your patient. Okay? Okay? And then critical thinking. This is where critical thinking comes in. In order to critically think, you have to be able to dissect the question, like I said, or dissect the scenario with your patient. Okay? So we find out what the patient needs. We have to, and there might be 10 things they need, but we have to prioritize the top 3. Okay? Out of those top 3, what is most important? Then, out of those top 3, are any of them posing a risk for something worse to happen? Okay? So, dissection of your situation scenario with your patient is just like a question. The question is your patient. You're going to have distractions. And you still have to be able to work through them. Y'all got ADHD. If y'all stick with me long enough, you're going to know I do not take medicine for it. I drink coffee. And sometimes y'all have to be like, Shay, reel it in. Hey, what was you doing? Y'all going to have to give me an ADHD belt. Okay. Hi, Miss Sally. Welcome in, love. I am talking to some new folks. Thank you for need some assistance, and I'm trying to be here to help them. Okay. So, if you didn't find the root, you'll fall for the distractor. Okay? If you don't find the root, you'll fall for the distractor every time. Our goal, thank you for coming, Miss Sally. Our goal is to find the root. Michael, welcome in. When you look at a question, just automatically be like, root, root, root. If you got to make up a song about it, make up a song. All right, moving on. So section 2, guys, the 5-step method. Everybody to section 2? I need to open up mine. Here we go. This is important. This is the meat of this class. Black Sheep, welcome in. Welcome in. Guys, make sure you go grab your daily heart me up here. Tap, tap, tap the screen. Share out the live. Let everybody know we're in here doing business. Your daily heart me is the attendance, guys. Heart me. The daily heart me is what makes this worth my while, okay? If you don't get your daily heart me, TikTok ain't thinking I'm over here doing nothing. And I need them to think I'm doing something, okay? Thank you all. Thank you for those hand hearts, Miss Sally. Thank you. Thank you, love. All right. So the meat of the class, guys. Speak slowly and clearly to yourself when you read the questions. Now, obviously, you can't talk out loud when you're taking a test, but if you're like me, I'm like, okay, I'm gonna read it to myself because if I don't, thank you for lighting up the gift gallery with those hand hearts, boo. Thank you so much. Welcome in, Bufferoni. Did I say it correctly? Okay, so we're gonna walk through the 5-step method. Okay, I want you to apply this to every single practice question you do from here on out until test day. Now, guys, I'm not telling you all not to look at test questions. I'm telling you to stop cramming. Pick a number of questions you're going to look at every day and do that. Do not cram. Okay? People need to be able to train their brain, even with the test taking strategy. Looking at questions is going to help you. And what I did when I was first learning this, because this OG, I'm talking about test taking, root stem analysis for test taking tips for the Nclex, which is nursing boards, Miss Sally. So everybody gets stressed out about the Nclex, and they literally um I mean, I have resources. If you guys are willing, I mean, you could go out here and buy stuff. It costs they're expensive. Okay, I can provide you guys with some questions, or I'll look and see. I already have like, you've been an RN 36 years. Miss Sally knows. So y'all look, Miss Sally's in here with us. RN for 36 years. Y'all give Miss Sally some respect. So Miss Sally, everybody say hi to Miss Sally. And y'all, if y'all aren't following each other, follow each other. We're going to be a support group. That's why I put you guys in a group. And I will be making other groups as well. Okay. Um, I will, uh, I will answer that question for you. I want to ask you a couple of questions first because of what you and I talked about, and then I could give you that. But I always like, I utilize my textbooks. When I was in school, I didn't go buy all these capstones and all that stuff. I didn't do that. I literally use my textbook. There's practice questions in your textbook. Thank you for that, Miss Sally. There's questions in your textbook. Okay? It's the same thing over and over again. You can only ask this question so many ways, okay? All right. So, what I want you to do, what I want you to do, the question. Do not skip to the answers. Read every single word of that question. And I'm speaking slowly and emphasizing because it's important. This is so important. If you don't listen to nothing else I say, I want you to listen to this. Guys, I want you all to pass. And I want you to come back and say, Shay, I passed. Okay? So I need you to listen to me. Not only have I done this twice, but I've done it twice in under 90 questions. And it took me like my RN Nclex took me an hour and 10 minutes. I had 85 questions. Okay? So, do not skim, do not skip to the answers. Read every single word. The Nclex loves to hide a little word like not or first at the very end. And if you miss it, you miss the question. Welcome in, Jessica. Okay? Because if it says first at the end of the question and you skim, you're going to miss it. And all those answers could be right about that question, except for which one do you do first? Okay? Do you follow me? Put a 1 in the chat if you follow me. Come on, guys. Put 1 in the chat. Let's go. Y'all got to do some engagement here with me. Y'all got to talk to me. Thank you for putting that 1 in the chat. Welcome in. Welcome in. Come on, y'all. Let's get some momentum going. Y'all need some coffee? Get some pep in y'all stuff. I work night. Let's get it. Let's go. Let's go, go, go. Okay. So no skimming. No skipping to the answer. No skipping straight to the answers. Read every single word of the question. Thank you, Liz, for answering in the comments. Read every single word, because every word is important until you figure out the root, and then all that other stuff is distraction. All right. Identify the root. What is it actually asking? Rephrase it in your own words. If the question says a patient with heart failure is gaining weight and has crackles, what is the priority? The root is simply, how do I treat? Wait a minute. I don't want to tell you. So I'm going to say this again, and I want you all to give me the answer. You're working on your 3rd attempt on the... Christina, we're going to get it. Okay? We're going to get it. When is your test day coming up in a couple, like less than 2 weeks? Somebody's test date's on my birthday, y'all. My birthday's July 11th. Somebody's test day is on July 11th. Your birthday, who? Are you talking to me, Liz, or are you talking to Christina? Next month. Okay, we got time then. We got time. Okay? We got time. We got this. And we're going to go over questions. Listen, I'm going to just tell y'all. This is the very first class I've ever done. Okay? I just decided to do it, and I did. God sent it to me, and I obeyed, because we have to be obedient. Amen? So when God sent it to me, I created the page, and literally... It's okay, Liz. You don't have to be sorry. Babe, you don't have to apologize, okay? So what I'm telling y'all is the Lord sent it to me one morning after work. I created the page, and I'm being obedient, okay? And just so y'all know, this is my TikTok shop page, and I do have to do TikTok shop lives. I did not do it today, but moving on, I will have my TikTok shop live on here, and I do have to talk about products for at least 10 minutes, but I'll try to make it geared toward nurses. So that you guys will be interested in listening. We'll have like tumblers and pins and shit. Okay? Stuff. All right. What's the question asking? Rephrase it in your own words. If the question says, I want y'all to listen, because I want y'all to try to help me with the answer. A patient with heart failure, this light's blinding me, is gaining weight and has crackles. What's the priority? So somebody give me, what is this question telling us? A patient has heart failure, they're gaining weight, and they have wet lungs. Come on, in the chat, tell me what it is. It's all this is textbook classic. This is as classic as it gets. Okay, water retention. So what is causing that water retention? She said I put kitty cats in there. What, Liz, what's causing it though? Heart failure, right? So water retention equals what? Fluid what? Fluid overload? Yes, thank you. You took it out of my mouth, Christina. Okay, so then, you can't hear me? Can you hear me now? Nothing to do with my mic. Can you all hear me now? Is it echo? Is it echoing now? I took my mic down. I was having issues at the beginning. So everybody can hear me. Now I can. It was glitching. Okay, good. So we know we're having issues with the mic. So let me stick it back in the case so I don't lose it. All right. So this question says, a patient with heart failure has wet lungs, right? Has wet lungs and is gaining weight, which is, we already got to that, fluid overload, right? So what do you all think this question is asking us? What is the most important thing and what is the safety? What is this question asking us? Come on, Christina, you're answering. Liz, anybody in the chat. What is the question asking us? What does it want us to do? What does it want us to treat? What is this? What is this? Prevention, not a treatment. Okay? Okay? But that is important, okay? It wants to know, how do we treat fluid overload? So, we're going to break it all the way down, okay? Lock in, y'all. Lock in. You ready? I'm blinded. This light is like glaring. Okay, keep that in mind, Lasix. Keep it in mind. So fluid restriction is a, Liz, we're getting there. This is a different kind of answer, okay? So basically this is the 5-step method, okay? This is in section 2 of your handout. Okay? So we're going to figure out if this is a positive stem or a negative stem. Y'all, the light, y'all see that? It's killing me. A positive or a negative stem. A positive stem asks what is true or the priority. Okay? The key words for a positive stem are best, first, initial, and most appropriate. Okay? A negative stem asks what is false or unsafe. Okay? Avoid contraindicated, further education needed. Always ask yourself, am I looking for the right thing to do or the wrong thing the patient did? Okay? So this question wants us to treat fluid overload. Okay? And if you think about it, that's right, Wap. And if you think about it, with fluid overload, the patient is likely short of air, right? Ding, ding, ding. Here, we're going, okay? Apply a prioritization framework. If the question asks what to do first, you must use a framework. ABCs is airway, breathing, and circulation. Always number 1, okay? I'm trying to block this light, y'all. Maslow's. Everybody knows Maslow's. We've harped on it, right? Physical needs before psychosocial needs. ADPIE. ADPIE. Always assess before you implement, unless it's an emergency and you already have the assessment data. Okay? ADPIE. Always. Okay? Assess before you implement. Unless it's an emergency and you already have the assessment data. Okay? You want to evaluate the answers and the answer choices. Notice that looking at the answers in step 5, you do not look at the answers until you know the root in your framework. Once you know what you're looking for, you eliminate all the distractors. Okay. So let's go look at question 1 in the guide real quick. Okay. Question 1 in the guide. There's a reason. Okay. Follow with me. We're onto something. Okay. So I'm going to read question 1 out loud. Okay. You ready? A nurse is caring for a client who is 2 days post-op. Never mind. We're going to do question 2. I want to do another question. I'm sorry. I want to do another question. Sorry. Don't shoot. Don't. Hang on. I have my notes, y'all. I have to keep notes because if I don't keep notes, where I have ADHD, like I literally go through and plan my whole class out. And if I don't follow it, then I get sidetracked and I jump to stuff. All right. We are going to do, we already did that question 2. Let's do question number 2, patient education and heart failure. Okay. This is under section, like it's closer to the back where you have like questions 1, 2, 3, 4, 5, 6, 7, all the questions. And you were asking, I don't even know why I didn't say that, but you were asking what questions. These are good practice questions that I put in here. I picked them for a reason. Okay. So we're going to do patient education, heart failure. A nurse is providing discharge teaching to a client newly diagnosed with heart failure. Which statement by the client indicates to the nurse that further teaching is necessary? Do y'all remember we were talking about positive and negatives? So what kind of question is this? Because the nurse says further education. So that means the patient may not understand something, right? It's not really what the patient did wrong, but there's an issue with the patient, so it's a negative. Okay? Which indicates I will weigh myself every morning after I go to the bathroom. I should avoid salt substitutes because they might have potassium. I will call my doctor if I gain 3 or more pounds in a week. I can use over-the-counter ibuprofen if I get a headache. Okay? So, daily weights, right? With heart failure, we know daily weights are important because why? If the patient's weight goes up, they're doing what? Retaining fluid. I went with this question versus the other one too because the first one was a positive, this is a negative. Okay? Daily weights are important with heart failure. Sodium, they should be restricted from sodium. They should call their doctor if they have gained more than 3 pounds in a week. All those things are accurate. Okay? But ibuprofen is an NSAID. Okay? So that last one is I can use over-the-counter ibuprofen if I get a headache. So the rationale is right here. Ibuprofen is an NSAID. NSAIDs cause sodium and water retention, which directly worsens fluid overload in heart failure patients. They can also reduce the effectiveness of diuretics and ACE inhibitors. This statement is correct and requires immediate correction. Incorrect. This statement is incorrect and it requires immediate correction. Why? Are patients already suffering from fluid retention? Fluid retention will what? Cause oxygen hunger, air hunger, shortness of breath, difficulty breathing. Okay? So that patient needs to know we don't want to make it worse. So if he says I can take an NSAID, that's not right. And this question asks us, which statement by the client indicates to the nurse that further teaching is necessary? So the root of this question is, the stem of this question is what teaching is the patient wrong about? Even though that's our own words. Which one of these are wrong? There's only one right answer. There's not even a maybe or anything. Okay? All those other three things are absolutely correct. That is what heart failure patients should do. Okay? Does this make sense, guys? Is anything starting to click? If it's not, tell me. Because that means I need to make a pivot and figure out a different way to break it down to you guys. Is this making sense? Put a 1 in the chat if it's making sense. Anybody? It's not making sense? Okay. All right. Guys, if you have questions, ask questions. I want you to ask questions. If you didn't understand something, hey, Shell, thank you, love. If you didn't understand, if you have questions thus far, go ahead and ask your questions. Does anybody have any questions? I don't see any questions, so I'm gonna tell you guys, because I put down a little something that I want you guys to do before our next class. Okay, one thing I want you guys to do our next class, if anybody's coming back. Are you guys coming back? If you're coming back, put a yes in the chat. Y'all did amazing, and I'm so glad that you took the first step of showing up. Okay, number 1. So thank you all for showing up. You showed up for yourself, and you showed up for me, and I appreciate you. Carrie Faith! Y'all, Miss Carrie Faith that just came in the room, she's one of my good old friends. Y'all should go follow her because she literally has a wonderful message for you every morning to get your day started off. I love Miss Carrie's messages. I love to see them. And she is a woman of the Lord, y'all. So Miss Carrie Faith is wonderful. Okay? So, here we go. This is what you're going to do for yourself, for me, and your patients. Okay? Before the next class, I want you to complete questions 2 through 5 in the guide. But I don't just want you to certainly answer. I want you to write down the root, the polarity, and the framework for every single one, just like we did today. Use the STEM analysis boxes in the guide. Okay? Remember my motto: healing hearts, leading with love, changing lives. You're not just studying to pass a test. You're studying to save lives. You are capable and you're called to do this. Guys, you've already done the hard part. You went to school, you passed. Now we got to take a test. Okay? You're called to this profession. You guys are going to be incredible nurses. Whether you know it or not, you're already nurses. You're already nurses. You passed the class. You passed school. You got to just take the test to get your license. Okay? Compassion in your heart, excellence in your care, and faith in every step. Okay? I want you all to know something. Thank you, Miss Carrie. The profession that we do, nursing, COVID did something to this profession that I love from deep within my soul. My sister had cerebral palsy, y'all. I've been nursing since I was 9 years old. Okay? Nursing needs people that care. If you don't care and you don't do this with your whole heart and you do not equip yourself, you're not doing a service to you or your patients. Thank you, Miss Carrie. Thank you, love. You're really doing a disservice to yourself and them. So, you have to prepare yourself. I am telling you that if you all get this down, and practice makes perfect, okay? You got 10 questions that you can work on. And the reason that I said that, I want you all to get the yellow notepad and a red pen. Because red says stop and yellow says pay attention, okay? I want you to write it down even though it's in front of you. I want you to write out what the 5 steps are, okay? And then when you're doing these questions, mark your answer out, y'all. Mark it out. I know I put them on here, but mark them out with a black marker. If you don't get it right, okay, we'll practice harder. That'll let us know what we need to be geared toward. I want you to break them down. You can even get different color highlighters. This is why this is color coded for y'all. Okay, mine's black and white. Y'all's is color coded. Different color markers, and if you got the root, the stem, distractions, highlight it. Okay, the stem is what we want. Highlight it in green. The root is next important. Highlight that in yellow. The distractors should be highlighted in red because why? They're distractors. Okay, get you some highlighters. The colors will trigger your natural brain. It's natural triggers. That says your natural brain. Lord have mercy. The colors naturally trigger your brain. Okay? And I want you to do these questions. Don't cheat yourself because I'll never know, but you know. So what you do, you're doing for yourself. Okay? Do these questions. I will have more content. I can go live tomorrow. I'm getting ready to leave for Florida tonight. I'll go live every day. I'm getting ready to leave for Florida tonight. So either I might be on the road or I could do it once we get to where we're going because it's 14 hours from here. But what I will do is make sure that I'll create the live event just like I did today, and let everybody know. I'm also going to put a LINK in my bio. I want you guys to do something real quick because this is going to be how you find files. Okay, you're going to be able to find files this way. If you click on my face, I'm going to show you all. Okay, if you click on my face bubble, okay. And you click on it again. Right here is my bio. When I say link in bio. So what I'm going to do, you're going to see I'm going to put my stand store on here so that all of my products and stuff can be in here. I'm going to put things in here for you guys, okay? And I will send you messages when they're in there. I'm going to work on it when I get on the road tonight. Okay? Did you guys get anything out of this class? Does everybody feel like, and if you didn't, I want you to tell me, but does everybody feel like that this was worth your time, or do you feel like it was a waste of your time? Let me know, y'all. And if there's anything that y'all need me to do different, let me know right now. Let me know. I had to stand up. My butt hurts. And what's going to help you all get this down? Do we need to go over questions and just practice breaking the questions down? Is that something you all need? I got one yes from WAP. Does that help you all actually breaking the questions down? Because I feel like practice makes perfect. And if you break down questions, so that's what we can do our next class, okay? I'm going to get some really good questions, but I want you all to work on these because I want it to be interactive. I'm going to, on our next one, I'm going to have it to where you guys can actually come up. It'll be a panel and y'all can actually come up and we're going to go, I'm going to get some higher level questions so that we can go in and we can really break these questions down. Okay. Are you guys better in the afternoon like this or earlier in the day? Because I work night shifts, so typically I'm better, even if I'm at work, like, because I'll be going back to work next week, I can still get on at 4 or 5 o'clock before I go to work. Okay. Afternoon. Okay. All right. So everybody, if you didn't get your heart me, go get it. Collect your points, do all the stuff, okay? And I'm gonna do everything I can to help you all. And I will have resources for you guys. I will have some different material in my bio on this page by tomorrow afternoon, okay? I'll have that in there for you. All right. Y'all, you took the first step. You're gonna pass. You know how when we was in school, you used to write your name on your paper before you did your assignment? I want you all to write your, I know y'all gonna think it's stupid. Write your name at the top of the page. Put your BSN, MSN, whatever it is, or LPN, RN, your name and your credentials. Name it and claim it. Okay? I'm going to end this with a prayer. I should have began it with one, but I got sidetracked. Dear Heavenly Father, I pray that you wrap your arms around me as I try to guide these future nurses, and let me know what I can do to teach these folks. And I pray that you will wrap your arms around them, take away their anxiety, open up their minds and their hearts, because this profession is truly something that you gifted to us. And I just pray that you will help me help them find the way so that we can pass this Nclex. We thank you for everything that you've done for us and the things that you haven't. It's in your son's name we pray. And they all said, amen. We don't need that, Albert. We're doing serious stuff here, okay? I got to get moderators, y'all. All right. Amen, amen, amen. God's good all the time, and all the time God is good. I'll see you later.